Hello student, good evening to all of you. I hope I am audible to you. Just give me a information that whether I am clearly audible and visible to you or not. Then we will start the session. So multiple question, yes. Thank you so much, Dr. Philip. So today in this evening we are going to discuss the physiology MCQs that has been asked in NEET PG 2023 examination. So this is basically a physiology recall session. All of you know that recall sessions is going on. So I am going to take here the MCQs which has been asked in physiology section in the recent NEET 2023 examinations, right? So okay, loud and clear. So first of all, this time in NEET entrance examinations from physiology there are around 10 to 12 questions that has been asked. So 10 to 12 MCQ is a lot MCQ as you know in NEET entrance examinations. So you have to read physiology carefully. But if you look at the MCQs, most of the MCQs are, I should say that on the easier side. Some of the MCQs are little bit tougher, obviously it will be there in each and every examinations. So overall the MCQs in physiology is in moderate, right? So they are not very easy, not very tough, in between, right? So in this session what we are going to do, we are going to show you the MCQs. Obviously it contains certain error because this is recall based session, okay? So if you want to correct any of the options, right? So please do let me know, and you can also write down in the chat box so that we can correct the options, right? Okay. So before starting the session, all of you know that this is purely based on recall from the students, and many students has helped me in recalling this session, including the PrepLadder team. But one student I will take name, Dr. Rivab. He has helped me a lot to recall these MCQs. So as a student, if you think that some of the MCQs options are not correct, please let me know, right? Okay, right. So we are directly going to the MCQs and their answer. I am not going to discuss the detailed discussion related to the MCQs because I know that all of you just want to know what is the correct answer. So the motto of the session is to give you the correct answer with proper explanation of the options only, not the related discussion, right? So the first MCQs is coming here, right? So a kind of image was given in the MCQ actual session. So the question was, one transport system across the cell membrane is given below. The process indicate which of the following. This was a similar type of question, right? So I hope all of you have answered this question correctly. So as you can find out here in the diagram, what you are finding out? You are finding out that there is a protein molecule which is attaching with this transporter substances, and then this protein molecule is changing its shape. So this is one of the most important thing here, that the protein molecule which first it is binding with the substances and then it is changing in its shape, right? So this type of protein is known as the carrier protein or transporter protein, okay? Carrier protein or transporter protein. In my last YouTube session also I had discussed this in detail, that whenever it is carrier protein, it cannot be simple diffusion. If it is a simple channels, then it can be a simple diffusion also. So whenever it is a carrier protein, it cannot be simple diffusion. So this is rule out. Now whenever you have identified that this is a carrier protein because it is changing its shape, then all these three can be your answer. But I hope all of you have identified that in this diagram, as you can find out here, that this is the concentration of the substances, this is high concentration, and this is the low concentration of the substances. Means the transport process that is occurring here, it is occurring from high to low concentration gradient. And whenever you have identified that this is high to low concentration gradient transport, then you can understand that this is a kind of passive transport. So passive transport with the help of carrier protein, only one answer is possible, and that is facilitated diffusion. But believe me, the carrier protein can be also required for this primary active and secondary active transport. As in my lecture class, in original lecture video, whenever you will go through this lecture video, you will find out that I have shown you this diagram, that carrier protein can be responsible for Okay, even the facilitated diffusion also, even the active transport also, it may be primary active or it may be secondary active. So, carrier protein mediated transport means it may be facilitated diffusion, it may be active transport also. You have to just check whether it is passive or active. And how can we understand whether it is passive or active? If it is happening along the concentration gradient, then it is a passive, right? So, this way you will understand and answer the first question. Great, great. 180 thing, oh my god, very good. So, first one is facilitated diffusion. Now, next question here, I think this kind of questions was there. Now, there are two kind of scenario, two different students are saying that the graph was like this, and some other school of thought they are saying that the graph was not like the previous one, the graph was actually like this. So, I do not know which was the actual graph, okay. But look at, if the graph is like this and if the graph is the first one, this, then the two different types of graphs are there. So, if this is the original graph, suppose this was the original graph which was given in the MCQs, right, then it is a clearance curve, okay, clearance curve. Now, all of you know the clearance curve formula. So, clearance is equal to C is equal to UV upon P, all of you know. So, this UV is the urinary concentration and P is the plasma concentration. Now, clearance means if a substance is freely filterable in the glomerular capillary and the substances is neither absorbed or neither secreted, then what will happen? Whenever you increase the plasma concentration of that substances, the urinary amount will also increase and the plasma concentration will also increase, because it is a freely filterable and no secretion, no absorption in the tubule. So, what will happen when the denominator and numerator both are changing proportionally, the clearance will remain same. So, that is why whenever you are finding out that the clearance of the substances is not changing with the plasma concentration, this X will indicate that this is typical of inulin, right, this is typical of inulin. Now, you can find out that this substances Y, it has a huge clearance, huge clearance. Huge clearance means the urinary substances, urinary amount of these substances is very, very high, and that is only possible if the substances is secreted in the urine. So, that is why this Y is a substances which is hugely secreted in the urine, and most probably this will be para-amino hippuric acid. Okay, and the curve which is given here as a Z here, that is Z. Okay, so these substances I can find out that up to a certain point of plasma level the clearance is absolutely 0, and then the clearance is becoming positive. So, think of glucose. If the person is non-diabetic person, then what will happen to the clearance of glucose? If the person is non-diabetic, then urinary amount of the substances is 0. So, urinary amount of substances is 0 means the clearance is 0. So, that is why it indicates that initially the clearance is 0, but later on when the person is becoming diabetic, the clearance is becoming more and more positive. So, this typically this Z will be the glucose, the Z will be the glucose here. So, this is glucose. So, if this is the same curve which is given in the actual MCQs, then your answer will be X is inulin, Y is pH and Z is glucose, that is a D, right, that is a D. And this thing I have explained in detail in my actual lecture video. So, as you can find out here, I have plotted the curve in the actual lecture session. So, you can listen this topic later on. But suppose some of the students are saying that the curve was not the clearance curve, the curve was the percentage of filter load remaining in the nephron. So, here the Y axis is completely different, it is not clearance curve, right. So, first of all you have to recall that which was the actual curve given in the MCQs, right. So, now if percentage of the filter load remaining in the nephron, if this is the Y axis, then what will happen? C, this curve, this substances C means the percentage of the filter load is not changing along the length of the nephron, right. So, that is typical of inulin. Then this substances D, I can find out that the substances concentration is changing, increasing when the substances is going from this Bowman's capsules towards the urine. Then how it is possible? Obviously, there should be secretion, and this is typical of PAH, right. Then I can find out that this substances A, this is becoming absolutely 0 at the end of the proximal tubule, within the proximal tubule. So, obviously, this substances has to be reabsorbed completely, and this is typical of glucose, right? And these substances B, it can be sodium, it can be bicarbonate like substances. So if this is the actual curve, then you have to understand that this D is the pH, C is the inulin, this B is the bicarbonate, because bicarbonate was also in the options, right? And this A is the glucose, right? So I have discussed both the graph. So most of the students are thinking that this second graph. So as Sandeep is saying, the second graph was given in the choices, but I have asked some student, they told me that clearance curve was given. So it is not the clearance curve, make it a point, right? So this is the complete the reabsorption and filtration curve which is given here, right? So anyway, whatever was the curve, this will be the answer in both the cases, right? Okay, chalo. Second one exactly. Okay, so this curve I had discussed in my last YouTube session. You know, there was a NEET PG marathon session when I took one physiology session, and this was the actual curve which I discussed in my last session. You can check it. It is there in the YouTube, right? Okay. Anyway, so next MCQ here. So MCQ number 3. There was a clinical history. Okay. The student was not able to recall the complete clinical history, but anyway, there was intravascular hemolysis and serum potassium level was given around 5.5 milliequivalent per liter. That was a catch in the question. So the serum potassium level was given 5.5 milliequivalent per liter. Okay, and they asked what will happen to the resting membrane potential. I think this was the question. Similar type of question was there. They were asking that what will happen to the resting membrane potential when the potassium is high. So some of the students are saying that the potassium is only 5.5 milliequivalents, are just borderline increase or mild increase of potassium. Do you think that the RMP is going to change? Because there was an option remain unchanged. Answer is yes. Even if it is 5.5, the potassium level is mildly elevated, mild higher version. And whenever the potassium is even slightly high also, the electrical activity start changing. Like for ECG, you will getting some changes. Same way the resting membrane potential will also get changes. So this remain unchanged is not going to happen here. Okay, believe me. 5.5 is also higher, maybe mild higher, but the electrical changes will start, right? So what will happen whenever potassium is becoming higher? As I have explained in my actual lecture. Okay, so this is the actual lecture video images. So as you can find out here, I have taken a myocardium cell, and whenever hyperkalemia is happening, means extracellular potassium is high, then what will happen? The resting membrane potential will change. Now all of you know the resting membrane potential is mainly due to diffusion of this potassium ion, which goes from inside to outside. Now whenever extracellular potassium concentration become higher than normal, then this diffusion of potassium from interior of the cell to outside will reduce. That means there will be a new equilibrium where more of the potassium will stay back inside the cell. If more of the potassium is staying back inside the cell, then the membrane voltage will gradually depolarize. The membrane voltage will gradually goes towards the positive side. That's why it is written here that RMP will be depolarized. Okay, depolarization of the RMP is known as the decrease in RMP, but depolarization means it is more positive. Now many of you are thinking that more positive means, suppose the RMP was minus 70 millivolt, it is going towards the more positive, suppose minus 60, it is also positive. If it is going to 0 millivolt also, this is also positive. So if there is mild hyperkalemia, can RMP move towards the positivity, and can it move up to 0 millivolt? Answer is no, it is never ever possible. The hyperkalemia cannot bring the RMP to 0 millivolt also. So this 0 is also not possible. Only answer that is possible is more positivity or depolarization. And because of this more positivity, you know, multiple problems will arises. One of such problem I have discussed, that heart may stop in diastole also. And what is the actual reason? You can listen the actual lecture for that. That is related to the voltage gated sodium channel also, right? A option was correct, yes. Right. RMP of the peripheral nerve. Okay, whether it is RMP of the peripheral nerve or whether it is RMP of the myocardium, this will change in same way. Okay, that's why the peripheral nerve will also suffer from problem due to hyperkalemia, and the myocardium will also suffer from problem due to hyperkalemia. Whether it is myocardium or your peripheral nerve, the same thing will happen. Got it, Dr. Arunesh? I think this is clear. So this will be more positive your answer. Okay, okay, chalo. Next MCQ. So before next MCQ, this is some information regarding the potassium changes. As I told you that mild hyperkalemia means the potassium level is 5.5 to 6.5. This is from literature. The moderate hyperkalemia is 6.5 to 7.5 and severe is greater than 7.5 milliequivalent per liter. So these are the few information. Okay, no changes if it is less than 5.5, but potassium is so sensitive electrolyte, you know, the RMP is mainly maintained by potassium. Even it is mildly high, the RMP is surely going to change, and you will get the changes in the ECG also, tall peak TO wave. Okay, so no change is not the answer if it is 5.5, right? If it is below that, then that is a possibility, but 5.5 is also mild hyperkalemia, right? Okay, okay, got it. Next, so one student told that there is a question like this, that if the dorsal column is hit or cut from the lateral side of the spinal cord, which of the following fiber is going to be affected, right? So the question was like this, that if this is the cross section of the spinal cord, this is the central canal, you know that the dorsal column fiber are located here, okay, and the anterolateral column spinothalamic tract are located here. Now if you are hitting the spinal cord here from the lateral side, which of this dorsal column fiber is going to be affected, whether it is cervical region fiber or sacral region or thoracic region. Now all of you know that under the cross section, this is the actual diagram which I have shown in my lecture class. As you can find out here that this is the dorsal column fiber, okay. Okay, it was asking about the weakness. So anyway, if they are asking about the weakness also, so if you are hitting this spinal cord from this lateral side, so the first fiber that is going to be affected is the cervical region fiber, and the sacral region fiber, they are located in the medial side, right? So whenever this spinal cord is damaged from this lateral side, first this cervical fiber is going to be damaged, and then gradually the lumbar and sacral region fiber is going to be damaged. So here, if this is the question, then cervical is the answer. Then cervical is the answer, okay. But you have to look at that what was the actual question. Some of the students are saying that this was not the actual question. They asked that if there is a cervical region injury, that then whether the upper limb fiber or lower limb fiber will be affected. This was the lighter question. Trauma to neck, proprioception loss is seen in. Okay, so whenever there is trauma to limb, you know the dorsal column fiber, they will be damaged ipsilaterally. So ipsilateral fiber will be damaged, dorsal column fiber. So proprioception is carried by dorsal column fiber, obviously the ipsilateral fiber will be damaged. Now if it is trauma to neck region, then obviously the lower region fiber, that is the fiber which are coming from the leg, they are surely going to be damaged, okay. Upper neck region, it depends that whether which region of the neck is damaged. So if you have to go one options, then you should go for the lower limb fiber, ipsilateral lower limb fiber, okay. But Dr. Manoj, I will be very grateful if you please post the question later on in a complete manner, and other students please help me getting the right option and if exact level of neck injury is given or not, okay. Otherwise it will be ipsilateral fiber, and better to go with the lower limb fiber, okay. So that way, otherwise if this is the actual question, then answer will be cervical region fiber, okay. Okay, so next next, this is a very easy question, and many students told that this was the actual question. There is a long history, but in that history the most important thing that was given is that resting tremor was given, and rigidity was also given, and the loss of facial expression was also given. And obviously all of the student has identified that the disorder is related to the Parkinsonism disease, and the diagnosis of the Parkinsonism, all of you know that this is due to problem in the basal ganglia. So in my actual lecture also I have shown you that what are the different clinical features of the Parkinsonism disease. So as you can find out here, akinesia, bradykinesia, resting tremor with 8 Hz frequency, okay. So this resting tremor and the intention tremor, they are the differentiating, one of the important differentiating feature between the cerebellar disease and the basal ganglia disease, okay. Along with that, this reduced facial expression I have also told you in classes. So these are the features that you have to read for the Parkinsonism feature, okay. So clear cut answer here is the basal ganglia, okay. Okay, so now next question, look at the question. I believe that there was an action potential diagram, and that is a neuronal action potential diagram, and different phases was marked with A, B, C, D. I am not sure whether the A was clearly in this position or not, but anyway there was different marking, and they were asking in the actual question that which of the following is true regarding the different marking. So as you can find out here, this A, suppose this is the marking. So A you can find out here, this is near equal to minus 75 millivolt. So this A clearly indicate that this is the resting membrane potential, right. So point A indicate threshold, this is wrong option, because threshold in the neuron is in and around minus 55 millivolts. So threshold in and around minus 55 millivolt. So this is a wrong option. Second, point B to C. So as you can find out from point B to C, this is the typical depolarizing phase of action potential, and all of us know that the depolarization phase of neuronal action potential as well as the myocardium action potential is due to sodium channel opening. So this sodium channel opening is the correct one here. So this is going to be my answer. Now if you look at the other point D, so C and D, between C and D, so between C and D, this is the repolarization phase. So all of you know that if this is the thing that is they are asking, so this is the repolarization phase. What will happen here, the sodium channel which was open, they will be closed, and the potassium channel, they will open up. So this will be your actual answer, okay, this will be your actual answer. Right. Then point number D, it is the potassium channel closure. So obviously this is a wrong statement, potassium channel closure is not the answer, potassium channel opening will be the answer. And point number E, absolute refractory period between B and D, between B and D. So between B and D, it is the depolarization as well as repolarization. Okay, this is actually known as the, okay, so I will look at the options. Point above B was mentioned as firing level. Okay, so if point B is mentioned as a firing level, then this is true. So B here, as you can find out here, this is the threshold voltage, because as you can pointing out here, B is minus 55, this is a correct statement. So B will be the firing level or threshold voltage. Between B and D is the refractory period. Now here you have to recall whether it is absolute refractory period or relative refractory period. Even if it is said that between B and D, B to D is the refractory period, okay, refractory period, then it is also a correct statement, because this B to D will fall in the absolute refractory period. Very good recall, very good recall, okay. B and D is absolute refractory period, and after point C, this is potassium closes. So that is absolutely a wrong statement, because after C, potassium channel has to open up, that's why the repolarization will happen. And at point E, neuron is hyperexcitable. So at point E, neuron is not hyperexcitable, the neuron is generally hyperexcitable at this point, right. So this is option obviously wrong option. So this B option and this B to D, if it is refractory period, then that is also a correct option. But before commenting on B as a threshold, you have to look at where the B is pointed. If the B is near equal to minus 55 like my diagram, then it is also a correct statement, right. So here there is a little bit multiple opinion, first positive then negative, sir, okay, but it was well above B. Firing level was mentioned beyond point B. No, if it is beyond point B, then that is not the correct, because firing level is a single voltage, that should be near equal to minus 55 millivolts. So according to your recall, okay, as I can find out here, Dr. Manoj and others has given some options. So I can find out that if sum is given between this point number B to D, okay, B to D as an refractory period, then that is going to be the correct option, okay, that is going to be the correct option. Otherwise, if something is given like this, then the option number B is going to be the correct one, okay, right. Between B to D, B to D is the refractory period, B to D is the refractory period, and option where threshold, ARP, sodium channel opening, potassium channel closure. Even B to D is the sodium channel opening can be the answer. So please put your head together and try to recall what was the correct option. But I told you that from the B to D, suppose this is B, suppose this is D, then you can easily say that from B to D is a refractory period, okay, that is the one thing. Then this B to D, during this B to D period, sodium channel is open, Okay, although the sodium is responsible for this B, but even during this D also sodium channel is also open, but when the D is starting, potassium channel has also opened up to a significant level. Okay. Now, this was the actual diagram that I have explained in my actual lecture class, and I am 100% sure that if you listen this thing, after this you will be easily able to exclude all the options in the examinations, because the detailed version of the neuronal action potential I have discussed in my actual lecture session, right. Okay. Next. So, next is a question on respiratory system. So, one spirometer recording was given, okay, and one part was marked, and the question was asked that what is this, whether it is residual volume or whether it is FRC, ERV or closing volume. Okay. I do not think closing volume was in the option, I have put it into the options, okay. But you can recall, but first of all you look at that this marking that I have given here, this was the actual marking or the marking was from this up to this 0 level, okay. Because if the marking is different, then the answer will be different. But please listen, in spirometer generally if something is asked, we know that spirometer cannot record the residual volume. So, it is very unlikely that they will mark this whole thing, okay, because in spirometer you cannot get the residual volume, okay. But anyway, if the question is given from this 0, 0 up to this, then the answer obviously all of you know that the answer is going to be FRC, right. 0 level, then it is FRC, but if it is only given here, then it is ERB, because again I am saying that this is recall based session, you have gone through multiple MCQs. So, there may be a problem in recalling actual recall session, but many of you are saying that from the 0 level. So, if it is from 0 level, then FRC is the answer, okay. So, if it is from 0 level, it is FRC is the answer, and if it is only from this lower level up to this end of the curve, then this is expiratory reserve volume. You all know this thing, okay. ERV was given in the choices, I know, that is why I am saying that ERV was also given in the choices and FRC was also given in the choices. Only difference that will make is the how much the arrow was extended, because why I am saying that ERV is the more possible answer, because in spirometer you cannot measure the residual volume. So, where this 0 will be you cannot determine, but again if the questions is given you cannot say anything, then your answer will be FRC only. So, you have to understand that whether the arrow was extended from 0 to this level, then it is FRC, but if it is only from the end level of the expression up to the end level of the curve, then it is the ERV, okay. And in my actual classes, I have discussed this clear cut spirometer curve, where you can easily understand that ERV is how much and residual volume is how much and how much is the FRC, okay. So, this was the actual discussion in the lecture video. Now, next question, again this is a repeat question and one of the easy question, and I do not know why this question they are asking again and again, okay, multiple times they have asked this question, and I believe that the examiners are very sensitive about this infant respiratory distress syndrome, okay. So, all of you know that the infant respiratory distress syndrome is due to deficiency of the surfactant. So, IRDS, this is due to deficiency of the surfactant, okay. And in my lecture class I told you repeatedly that whenever they are asking about surfactant, although we know that the major phospholipid that is present in the surfactant is the DPPC, but they may not give you the option DPPC directly, but the other name of the DPPC is this lecithin, right. So, that is why in my actual lecture class I have shown you this whole thing, that the composition of the surfactant is the lipid is the major component, and the major lipid is the phospholipid, and the main phospholipid is the DPPC. DPPC is also known as dipalmitoyl lecithin. So, this lecithin is going to be your answer of choices in this question. I do not think that other discussion is required here. So, you can read it this later on, and why you should read up if your rank is very good, then you do not have to read up, okay. So, I wish you all the best for the good rank, okay. Now, there was another question. Now, please student tell me whether this question was also there in the examination or not, because consecutively 2 questions and similar kind of answer. So, that is why I am asking whether this question was also there or not, that if the surfactant is deficient in the lung, which of the following is going to happen. This was there in the examination. Some students were saying that this was there. Yes, oh my God. So, the examiner are very fond of surfactant, right, okay, very good. So, if the surfactant is deficient, so all of you know that surfactant is there to reduce the surface tension. Okay. So, this surface tension is an inward directed force. It will try to causes collapse of the lung, right. Okay. So, sir, in this question they ask difference between child lung and adult lung. Okay, child lung and adult lung, right. So, always remember that if this is the question, then surfactant deficient means surface tension will be higher, and whenever surfactant is deficient, the lung will be hard. You will not be able to expand the lung, means compliance of the lung will decrease. So, the compliance of the lung will decrease. So, if this is the actual question, then your answer is B. So, your bottom line is that if the surfactant is deficient, then compliance will be reduced and your surface tension will be high. Now, I am coming to this child and adult. Okay. Now, see here, in my actual lecture classes also I have explained that the high compliance will be seen whenever there is either loss of elastic tissue of the lung, like for example emphysema, okay, asthma and old age lung, right. Loss of elasticity will be there and compliance will be high, or compliance can be high whenever there is reduction of the surface tension. How to reduce the surface tension? By increasing the surfactant. So, from here you can directly answer the question. Okay. Now, in comparison to adult lung and the child lung, so adult, okay, and children lung, always remember whenever the size of the lung is more, the compliance will be more. So, in case of adult lung, the compliance will be higher than child lung. So, compliance will be lower. More the size of the lung, more will be the compliance. Getting my point? So, if this is the ask, this is they are asking that child has more compliance or less surfactant. So, child lung has more compliance, right? Got it? So, this way you have to answer the question if the compliance of adult and child is asked, right? Okay. ठीक है, right? Okay, so I will change the options here. So, please, C section was also included. Okay. So, please post the options if you could recall exactly, then I will go through the options once again. But anyway, these are the information that you can nurture in your mind and you can find out the answer also. Okay. Now, next question here, this is the questions on the myocardium action potential. So, cardiovascular system MCQ, child in comparison to adult, more compliance, yes, more compliant. Okay. So, more compliant lung will be there in case of children, because more the size of the lung, more will be the compliant. Okay. And obviously, the surfactant will also be more mature in adult lung, right. Okay. So, but anyway, again I am asking you, please give me the correct options if you could recall in this chat box only. I will later find out this chat box and I will correct the options. Okay. Now, look at this question. This is one of the very easy questions. Every student will read this thing before going to their exam, I believe. Okay. So, this is the myocardium action potential, and all of you know that here this phase 0 is due to sodium channel. So, whenever this options is saying that potassium channel causes this phase 0, so this is a wrong option. Then this phase 1 is due to transient potassium current. So, phase 1 is not in the choices. Then phase 2, we all know that this is the plateau phase. This is due to entry of calcium as well as parallel exit of potassium. So, if this is the question is saying that the phase 0 is due to calcium channel opening, then this is a correct statement and this is going to be my answer. Transient sodium channel open in phase 3, this is absolutely wrong. Calcium channel closes in phase 4. So, this phase 4 is the RMP, it is not related to the calcium channel closure. So, that is also a wrong statement. This phase 3 is the repolarization phase, this is due to opening of the potassium channel. And if you look at my lecture, in my lecture I have discussed the detailed types of potassium channel, that this phase 1 also require potassium channel, this phase 2 also require potassium channel, this phase 3 also require potassium channel. What are the actual potassium channel which is required for these different phases, that I have discussed in detail in my actual lecture, right. So, this is very easy question, I believe all of you have answered correctly. Okay. Now, this last question, this is a very easy question, and every teacher, most of the teachers are discussing this question, that some question was related to that vitamin K dependent clotting factor. I don't know what was the actual question, whether they were asking about the gamma carboxylation or whether the vitamin K dependent clotting factor directly, but all of you know that if this is the question, that vitamin K dependent clotting factor, then all of you know that this is 2, 7, 9, 10 was the option. So, I believe that between this 2, 7, 9, 10 any of the options was given and you have marked it correctly, right. So, this is the actual lecture discussion, lecture class PPT that I have shown in my actual lecture, the chapter of blood physiology. So, as you can find out, the vitamin K dependent clotting factor 2, 7, 9, 10, and I have also discussed among all these factors the shortest half life is the factor 7, and because of which this prolonged PTT is seen in case of early vitamin K deficiency, right. So, this is all about the MCQs that has been asked in physiology. So, as you can find out here, altogether around 10 to 11 MCQs. Okay. So, I believe most of you have done well, and just take a break for few days, relax in between, and don't worry whether you have done some silly mistakes or not. Whenever I have discussed with other students, most of the students are saying that they have done some silly mistakes. So, just relax, okay, and keep quiet, relax, and best of luck for your result. So, thank you and best of luck for listening and best of luck for your result. I believe all of you are going to get a good rank in the upcoming result. Thank you so much. Thank you. Thank you, Dr. Manoj. Thank you, Dr. Shoma and all. And please, my request, please post the MCQs and their correct option if you recall. Thank you so much. Bye bye. Take care.